Physical Problems, Psychological Sources, Chapter 22. Health is a concept embodying the whole person. For nursing, it is holistic. It is a state of well-being in which the physiological exam is in balance with the physical and the emotional realms. The fight or flight response is an essential part of every animal's survival mechanisms. We exhibit physical manifestations of anxiety and stress, like sweating, increased heart rate, and increased blood pressure. The general adaptation theory does have 3 stages. The alarm stage is first, where the body will recognize the stress and prepare to resist it. The stage of resistance is second. If the body is unable to adapt, then the 3rd stage will appear. The stage of exhaustion is the 3rd stage. If this stage continues, then illness may occur. People who are able to recognize and diffuse the stress in their life early, they seldom experience any physical effects of the stress. Some individuals will struggle with stressors and the body's response. Some individuals will focus their stress into the body activities and its functions. These individuals will develop physical symptoms that arise from psychological sources. These problems are known as somatic symptom, somatoform, psychosomatic, or psychosocial disorders. Infants will require the routine attention of a consistent and a constant caregiver, someone who feeds them, cuddles them, and protects them. Children learn to cope with stresses, and their brains change. Biochemical reactions to stress alter the physical patterns of the brain and synthesize the children to future stressors. Patterning in the brain sets up an automatic chemical response to stress. These actual symptoms that are listed by different systems within the body were once referred to as psychosomatic illnesses, meaning emotionally, which is psycho, related to physical, which is somatic disorders. Today, this term psychosomatic means imaginary illness. The more recent term that is being used is psychophysical disorders. This was coined to refer to stress-related physical problems. The physiological stress response affects many different body systems. Biological theories state stress response theory where individuals are biochemically repatterned to react to stress. During times of stress, the autonomic nervous system or the fight or flight response kicks in because the threat is not external. There's no physical outlet for the biochemical response. Organic weakness, where every individual has one body system that is more sensitive than other body systems. The psychodynamic theories are where certain personality types are more prone to develop certain illnesses. The hardworking, independent, overly ambitious executive is at high risk for developing cardiac problems because of his aggressive personality. Historically, the mind and body were considered separate when related to the cause and the treatment of disease. The more that is understood about human biology, the more is now known that there is no mind and body separation. One or more symptoms or deficits affect the voluntary motor or sensory function and suggest neurologic or other general medical conditions. The symptom or deficit is not intentionally produced or fictitiously but it does cause clinical significant distress or impairment related to social, occupational, or important areas of functioning, and a medical evaluation is necessary. The Japanese, gammon means to internally suppress emotions, especially anger. Emotional distresses are expressed through physical signs or symptoms. Illness is a socially acceptable way of receiving care. Body functions, especially blood pressure, are of concern. Headaches are often related to depression. The Southeast Asians. Mental distress is not discussed, but it is expressed as various physical ailments. Koro is the fear of the penis shrinking into the abdomen, which individuals will believe results in death. For Hispanics, it is maldeojo ojo, the evil eye, is associated with fever, headaches, diarrhea, restlessness, irritability, and weight loss. The East Indians over in India, Dot syndrome consists of male reproductive signs and symptoms caused by fear and concern about losing semen. For the Koreans, the body is the property of the ancestors. Mental and emotional illnesses are expressed as physical or somatic complaints. Diagnosing somatoform disorders in children and adolescents is harder because the expression of emotional stress in the form of physical complaints is developmentally already appropriate in younger children. If they don't want to go to school, they can have a bellyache. When physical symptoms are persistent and a child's functioning deteriorates, then it is a consideration that a somatoform disorder may be indicated. Somatic Symptom Disorder. This begins before 30 years of age, sometimes as early as adolescence or childhood, and it can persist for multiple years. Somatic symptom disorder occurs more frequently in women, and it appears to have a familial pattern. It is seen in 20% of the daughters of women that were diagnosed with somatic symptom disorder. Male relatives of these women show an increased risk for antisocial personality disorders and substance abuse problems. The most common complaints are a combination of GI tract and sexual problems with pain and false neurologic symptoms. So there are criteria to diagnose a somatic symptom disorder. Number one, the history of pain related to at least 4 different sites or functions. The history of at least 2 GI tract symptoms other than pain. The history of 1 sexual or reproductive problem other than pain. The history of at least 1 symptom that suggests a neurological disorder. With functional neurological symptom disorder, the symptoms or deficits affect voluntary motor or sensory functioning. Physiological factors associated with the problem, because the initiation or exacerbation of a symptom is preceded by conflicts or other stressors. The problem can't be fully explained by a neurologic or a general medical condition and is not a culturally sanctioned behavior or an experience. There are specific criteria for a conversion disorder. At least 1 sign or symptom that involves the voluntary motor or sensory system, and it suggests a neurologic disorder. Signs and symptoms that are brought on or worsened by the presence of a conflict or other stressor. Signs and symptoms are not intentionally produced. Signs and symptoms cause significant distress and impairment in daily functions. And the last one, after extensive investigation, the signs and symptoms cannot be explained by a pathologic condition or the effects of a substance and are not culturally appropriate behaviors. All of these need to be seen and discussed for a conversion disorder to be diagnosed. There are criteria to be diagnosed with hypochondriasis, illness anxiety disorder. There must be a preoccupation with fears of having a serious disease based on a misunderstanding of body messages. The preoccupation must not be delusional. The preoccupation will persist despite negative diagnostic testing results. The preoccupation will cause significant distress or impairments in activities of daily living. And the last one is the preoccupation has been present for at least 6 months. Each of these need to be witnessed for an illness anxiety disorder. So a person can be affected by a fictitious disorder that wants to assume a sick role. A malingerer is an individual that is looking to attain secondary gains. Munchausen syndrome is when an individual deliberately produces signs and symptoms of a disease process in another person. Situations that are heard of routinely involve a caregiver, whether it's a mother or a babysitter, that introduces signs of illness in a child and then presents the child for medical care. Munchausen syndrome is an actual form of child abuse disguised as a need for medical care. The type and the severity of the signs and the symptoms will vary with the medical knowledge known by the caregiver. The diagnosis is challenging because offenders or caregivers will commonly remove their victims or the child as soon as the disorder is suspected. Caring for clients with somatoform disorders is both challenging and rewarding. Possible therapies would be individual therapy, group therapy, family therapy, cognitive behavioral therapy. So key interventions for individuals that have these psychophysical problems, for a nurse, it's to convey an attitude of acceptance and understanding. We need to meet all the physical needs of the patient during the acute feelings of illness. We need to make sure that the secondary gains are minimized once the acute phase of the illness is resolved. We need to, as nurses, use the patient's level as an anxiety as a gauge to determine the amount and the type of health teaching needed. We acknowledge the individual as a responsible adult while indirectly addressing their dependency needs. We encourage the client to talk about their feelings, and the nurse will assist the client and the family in enlarging their social network.